Exercise should always be favoured over medication. You want a pillow that keeps your neck in a relatively neutral position. Ideally, you should be able to get up at the end of the day and not feel sore as a result of it. I think in general terms, exercise should always be favoured over medication, and exercise has a big role to play in the management of back pain. But we've got to be very cautious about making a blanket statement about back pain, because back pain on its own is not a diagnosis, it's a symptom. And so recommending one particular treatment technique as opposed to another for broad-based back pain is not appropriate. Pillows that don't allow you to move around or don't allow contouring are generally not that beneficial, because they keep your neck in one position all night. And that usually means patients will wake up with muscular neck pain in the morning, because of being kept in one position. So if you're a patient or if you're someone who sleeps on their side, you want a pillow that keeps your neck in a relatively neutral position, rather than being, if it's too big, it will push the head too much. If it's too narrow, the head will collapse to the side. So you want a pillow that will keep you in a neutral position, yet allow you to move during the night. It's a sound advice, if you're going to spend 6, 8 to 10 hours a day sitting on something, that it should be ergonomic and comfortable. Ideally, you should be able to get up at the end of the day and not feel sore as a result of it. So a well-padded chair that is contoured for your body, and one ergonomic chair is not quite the same as another ergonomic chair. It's a bit like mattresses. A lot of mattresses are sold on the idea that this is good for the spine versus one that's not good for the spine, or supposedly they should all be good for the spine. But it all depends on how you sleep. If you're someone who's predominantly a side sleeper versus a front sleeper versus a move around sleeper, you will sleep in a slightly different way to someone else. So therefore, whether or not you need a soft mattress or a firm mattress is quite different. And it's the same with chairs. If you sit in a certain way and slouch in a certain way, you might need more support than somebody else. So you find a chair or a mattress that suits you. Ideally, if you can get up in the morning without being in pain, you're sleeping in the right mattress. If you can spend all day sitting in a chair and get up without being in pain, you're sitting in the right chair. In general, a chair that contours to the normal anatomical configuration, i.e. having a certain amount of lordosis, like slight curvature in the back, is preferable. Ideally one that's got arm support so you can rest, and one that's reasonably comfortable that you can move around and not spend hours sitting in the one spot, because it's that sitting around in one spot that often causes muscular back pain.